Hello and welcome to the Society with Fatma Shaheen at BTV World. October, as we all know, is celebrated to be Breast Cancer Awareness Month, which is why today on our show we'll be talking about the same. We'll be talking about not only the disease itself, but also, possible causes of the same too, to the extent that they are clear by that virtue. We'll also be talking about the fact that when we do talk about breast cancer, why is it so important to also talk about, the challenges that not only breast cancer survivors or patients for that matter face, but equally what are the challenges that their respective families, their respective caregivers also come across. In this regard, we'll also be delving upon the fact that, what are the typical socio-cultural norms which do surround this very disease. And fortunately, still in Pakistan, although generally we have seen more and more people coming forward reporting about the same too. Last but not the least, we'll also be delving upon the fact that if we as a society are serious about, combating this disease, then what are the areas that we need to focus upon, be it for that matter creating mass awareness about the disease, be it for that matter having a more holistic approach towards catering to the same, or for that matter even having requisite policies to that effect too. All of this today, that too with a very eminent panel. Let me introduce you to my today's panel. My first panelist for today's show is Ms. Fariha Faisal, who is a cancer survivor. Assalamu alaikum ji, and welcome to the show.
Walaikum assalam. Thank you so much.
You're most welcome. Alongside her, I have Dr. Huma Majid Khan, who is a surgical oncologist. Assalamu alaikum ji, and welcome to the show, madam.
Thank you.
And my third panelist for today's show is Faisal Javed Saab, who is a caregiver of cancer survivor. Assalamu alaikum ji, and welcome to the show.
Walaikum, thank you.
You're most welcome. Now, to get the conversation started with you, Ms. Fariha, I think it's very important at the outset to talk about the way cancer was diagnosed in your particular case. Now, we do see that there are those typical cases where people actually experience symptoms of the same, because of which, of course, then they then rush to doctors. But what happened particularly in your case? Could you please tell us?
I just went to a doctor for my journal checkup, and then he said we have to do your biopsy, and these are all new terms for me, that what is biopsy and what I am going to go through all of this. And then they, that they did my biopsy, and they sent it to different laboratories, and then they recommended me few hospitals that you have to go to all these hospitals and get it checked. And then I just this news break to me by my family that you are going through this cancer.
So you were the last one to find out.
Yes,
then,
I was the last one to find out that I am going to, I have this disease and I have to fight this disease.
So what was your first reaction when you found out unfortunately contracted cancer?
Yes, obviously it's very tough, and it's been like 17 years, but still it was a very shock of your life, and like am I going to die from this disease, because at that time there was no good example in front of me that people are going to survive from this disease. So that was a real shock for me.
And 17 years ago, even if you see the stats generally, there was generally perhaps less awareness about this disease too, and more stigma here too, on which I'll come to you, Dr. Sabha. I think your narrative here again becomes very important then. Do you not feel that over a period of time, one positive thing which has emerged is the fact people generally, men and women alike, they are generally more open in talking about this disease, even if it is in certain quarters of the society, be it the elite class, be it the upper middle class, because there was typically this time where even talking about it on television was considered to be taboo.
I think in the last decade or so, there has been a normalization to somewhat lesser level, but still it is there.
Right.
So I used to hear a lot about that. I would not tell my son about the thing, so what would he say? And so people would hide their symptoms, they were shy about it. Less and less I heard that sort of a story. It's more about economics and other problems now, rather than the shyness around it. So yes, you're right that because we are talking about it, it is normalized to some extent with the breast cancer awareness programs.
But moving on, madam, here we must also talk about at a very core level that what exactly is cancer, and then moving on to the extent that science does explain it, what are the causes for the same, because it is very clear then that only in 5 to 10% cases this is something which is caused by faulty gene per se.
Basically, I think what I would like to just give you an outline about is that what is cancer. If we look at a cell, it becomes mature and then divides, and then matures again and divides. And then in the process, once the whole thing is collectively formed, it stops. Cancer is a cell which loses this control. So there's anarchy at a cellular level. It continues to grow and multiplies, and without becoming mature, it keeps on growing and multiplying. So this is body's own cell which has gone haywire.
Right.
So there can be two kinds of triggers. One is that you have a genetic trigger. There's something wrong with the genes. Either you have genes which can cause cancer, you have faulty genes which can cure the defects,
Right.
or you can have an environmental factor which
Exactly.
can come and induce it. And a lot of times there's a mixture.
Right, madam, your point is noted, on which I'll come to you, Faisal Saab. Here, we must talk about a very pivotal role of caregivers like yourself, and this is definitely something which is often ignored, because I at least feel sometimes the focus is too much on the cancer patient as opposed to, you know, the ordeal of the caregivers too. So, as somebody who did support his wife during her cancer journey, what were the most pressing challenges that you came across, be it financially, be it emotionally, be it even psychologically?
Well, to start with, initially when this was diagnosed, I knew the name cancer, but I wasn't aware of what are the side effects, treatment, you know, the quality of life would be. So the first challenge I faced was that fear of unknown, that how would I navigate through this. So to overcome that, obviously I went online, did some study, discussed with doctors, and after that, obviously, once we are through that, then there was a financial burden, obviously, and I was working at that time, so I had to go to the hospital with her daily. Sometimes when she was admitted, I was spending nights there. So I obviously that work thing was very much disturbed.
Your work was being disrupted.
Yeah.
And also the psychological toll or the emotional toll that it must have taken on you or her relationship, because a lot of times we've also seen, Faisal Saab, cancer unfortunately becomes that one reason because of which people's relationships actually break. We have seen divorces happening when any of such things surfaces. Like I do feel that you must be given credit for this, because a lot of times people just choose to walk out of relationships when they see that their respective spouses have fallen ill. So in this case, how do you feel did it impact your relationship? Did it at one end strengthen it, or did it on the other hand worsen perhaps the existing problems which were already there?
In my case, I would say that going through this hardship together, our relationship evolved to the next level, and we made a stronger bond with each other.
MashaAllah.
I know that might not be true for everyone, but when this thing happened and I supported her, and ultimately she got to a recovery period, I feel that we were more openly communicating with each other. We understood each other more better, and our relation, we basically made a stronger bond with each other.
Right, Faisal Saab, on which I'll come to you, Ms. Faria, and here we must take your perspective into account as well. So when we do talk about how it does not then in turn impact one's relationship, do you feel at a long-term level it had a lasting impact in your relationship? Because then you see, it's just not about fighting that disease off, it's also about surviving it and then living with that thing for the rest of your life.
Well, whenever I go to any session, I praised my husband a lot, and I believe that I am surviving this disease just because of him, because he is constantly,
and his support.
Yes, and that support. And am I doing the exercise regularly? Am I eating properly? If I am eating too much sugar, so he is, you know, very religious
He's
about
very
that.
vigilant
Yes,
about
very
it.
vigilant about that. Ki you should not eat this much sugar. So yes, he is always there, and the support is very important. And in a longer run, I think people believe that they need kids to be happy and, you know, live together happily. And I think we too are living very happily together.
And that's enough for you.
Yes, that is enough for us.
So you see, then again, it does impact your long-term family relationships too that way, because that is something that you both have mutually decided then. Yes. But when we talk about the way this disease then impacts one's own self, be it their physical being, be it their emotional being, we have seen cases where chemotherapy, it does inevitably impact people perhaps in ways more than one. People end up losing their hair, they might just lose weight too. So when you were going through your treatment, did the treatment itself in any way adversely impact you or your mental health?
Obviously, it impacts you mentally and emotionally as well, because this is not a disease of just your physical damage, it also damages you emotionally and mentally as well. So you have, after the treatment is over, you have to take good care of yourself, your food and your exercise, and plus you have to focus on your mental health as well. So I, you know, by chance I went to a happiness program, and there they said you can control things from your mind. So at first it was like, how can you control things from your mind? But then I started manifesting my side effects, so I can actually, you know, find out that my side effects are subside. So yes, these things actually help you a lot,
of course,
because you are living in your, you know, that mental capacity that we are gone through this, and now this is not gonna over for the rest of
it's
our
all
life.
about the mindset, you see, Miss Faria, because they say it's just not the disease which kills you, it's also that mindset with which you approach things, and this is something that we generally see applying in life too. Madam, I'll take your narrative here too. We understand that perhaps these two individuals, they were privileged, they were educated, they had the right resources too, so as to fight off the disease. But on an average, Pakistani women comes to you, how cognizant do you find them to be of breast cancer?
When they come to me, obviously they feel something, so they are concerned, they are worried that it might be something. And when they come and you give them the diagnosis, the first thing is, will I die? The second thing is, will I lose my breast? So these are the two biggest fears. Sometimes actually in reverse order as well. Some women bring death later on, especially young unmarried or young married women. They are more concerned about that.
Of course.
But even older women, because it's about body image.
Right.
So a lot of women take femininity, the completion of their wholeness is linked to the preservation of breasts.
Right.
So yes, they are very much concerned, and they are like, they come with a fear, and that's the problem, because a lot of times people come late because they are fearful.
Madam, this is something I would want you to elaborate upon, but before that, one very important thing which you just mentioned is the fact that you've seen more younger women coming to you as well.
Yeah.
So how do you explain these statistics? Because we also understand that research indicates in Pakistan, and women, if they do develop breast cancer, there is a greater chance of that being more aggressive. And then also we understand the fact that, you know, more and more younger women are now complaining about the same. So how do you correlate this with our environmental factors, with various lifestyle factors?
I think there can be many things. One which I don't have like any evidence, but I think that because we have the highest number in Pakistan and other South Asian countries, I think intermarriages, genetic predisposition, intermarriages can play a role, because we are not talking just about the bigger genes which give you a higher chance. There are lots of other smaller genes.
Right.
And when you intermarry a lot, then you can pass on good genes and you can pass on bad genes. That's number one. Number two, we have like a larger, younger population anyway, because we have less older women.
Of course, we have that.
So we see more younger women because we have more younger women. The third thing is that the population is really multiplying rapidly. So if the absolute number of people is increasing, the absolute number of the cancer will also increase, and all the diseases will increase.
But the positive out of everything is that now there is generally more conversation about the same.
Of course.
It is something which needs to be acknowledged, and this is something which needs to be appreciated too. Faisal Saab, coming towards you, when we talk about the role of the caregiver, we understand that yes, you have a very important responsibility on yourself to fulfill, but then this again would also impact your own health too. A lot of times we see people who are caregivers, they might perhaps be going through stress, through anxiety, through depression themselves. Of course, seeing somebody they love suffer so much. So how was it that you, in your own right, actually, you know, came out of this? Because you would also be needing then something to relax, to revitalize.
You're absolutely right. Because providing support to your loved ones in this disease, obviously is very challenging. I remember I used to take her to the hospital, and by around the end of her treatment, I developed kind of a weird feeling going to the hospital, because one of the reasons was because I had read so much about the disease. I would go to the hospital and see other patients with different kind of cancers coming in. And I still remember that I read a essay of The Man Who Was a Hospital in my English literature some time back. And each time I would have a pain somewhere in my stomach, my tooth, I have some
and you would have a
kind of
cancer scare.
cancer side effect, cancer symptom would come in my mind. So fortunately it was around the end. But generally, I had couple of close friends who I could talk to, some family members who helped me out of this, and to further keep my mind off these kind of worries and kind of.
So how did you
myself.
then basically revitalize then? Because I remember you telling me video games were your way of letting all the tension out, because then you were focusing all your energy on those video games.
Yeah, I used to go to gym, so I continued that. And
exercise, of course.
Yeah, exercising. I used to go to gym for an hour or two. I am into video games right now, even at that time. So I used to engage in both these activities which I love doing, and these used to take my worries off and give me the necessary break that I needed.
And then you also had a very supporting
work
work environment too, because a lot of times caregivers, they need to have that right balance between their professional commitments and looking after the cancer patient and the cancer survivor too. On which I'll come to you, Faria, and here we must talk about this very important concept of self-care and self-love. A lot of times we see that when people do go through chemotherapy, they might end up losing their hair, they might end up losing weight. So why is it so important for cancer survivors or patients like yourself to actually emphasize more on body positivity in cases like these?
First of all, you can't stay miserable for the rest of your life. So self-love is very important for any given situation. And in my case, you have to put an extra, if you are cancer survivor, you have to put an extra effort for your well-being. Well-being is very important. And the food you are eating, like you have to be very particular what kind of food you have to eat. You have to have an healthy eating habits. Then exercise, you have to do your exercise daily. That is recommended by my doctors. And trust me,
and even if you see losing hair because of chemotherapy, because I've seen a lot of cancer survivors actually do that, they very happily wear wigs, they don't have issues with that. If they are losing hair, then they are making their fake eyebrows. So there are ways to go about it. It's all about your internal morale, you see. But another issue, I think this is something that we need to talk about, which is very intrinsically linked with cancer, that of mental health. A lot of times we see that people, they become chronically depressed. They might suffer from anxiety, of course, for the reasons that we all understand. So why is it so important for people like yourself or even caregivers like him to continuously seek therapy whilst you're seeking treatment too?
Yes, it is very important to look after your mental health, and you can do mindfulness practices like meditation. I do my meditation daily, and yoga is another option then which is very good as an exercise, and plus it's very good for your mental health. And you can also go to any therapist.
Right, Ms. Faria, on which I'll come to you, Dr. Homa, and here we must talk about the need for there to be proper communication between the patient and the doctor too. Now in the West we see that there are proper breaking news protocols when it comes to imparting news of cancer. But in Pakistan, how frequently do you see this news is actually given to the cancer patient in a very empathetic manner, something which is truthful but something at the same time which keeps in mind the sentiments of the patient too?
It's very, very important what you've touched upon. I would like to say that if the patient knows what's happening, then they cope with it better. And unfortunately in our society, what happens is that everybody else jumps in, the whole family is excited, and they want to know, and they don't want the patient to know what is happening.
Exactly what happened in your case.
Which is not a good thing, because still the patient is involved. She is not, or he is not going to have a control.
Right.
Everybody is bound to feel unhappy, tearful for a few days or weeks, but then they get over it, you know, like any other grief or loss. So one thing which is extremely important is to involve the patient. It is according to medical ethics and legally and by all norms that it's the patient's choice. Who else needs to know? And you can't really talk to other people, no matter whoever it is, except in the case of minors.
So
You
if
have to tell
anybody
the
like
patient.
this comes to you, like typically both a husband and a wife, so how would you ensure that yes, this news is actually given to the wife in a very empathetic manner?
What I do is slightly different. Some people may like it or not, because in Pakistan we have like a stratified society. You have very rich people, you have very poor people, you have educated, uneducated, and within those there are different mindsets.
Right.
So you have to, number one, see what your patient is like, you know, what kind of socioeconomic background, what are their fears. And then I want the husband or whoever is the other person to sit behind the patient and not to basically take over the conversation.
That is so important.
You talk to the patient and you ask them to please patiently listen to the whole thing, and in the end we can answer your questions. Because if they basically hijack the conversation, then nobody knows what's happening.
And this is something that does happen more often than not,
Yeah, yeah.
because
Oh,
in their
yes.
own way they are trying to protect the patient, which should be done. You know, the news should be given to them in a more
in a nice
manner, empathetic
way,
manner, exactly.
giving hope, but at the same time you can't hide reality.
You can't hide reality.
You have
basically.
to be truthful.
So it's a very fine balance then.
Yeah.
But Dr. Saiba, one important thing which we see and which we must clarify using today's platform is the fact that not in every case we've seen when it comes to breast cancer, there must necessarily be some kind of a lump which actually relates to such findings. Then we've also seen other symptoms being there. So for the clarification of the audience, could you tell us that what should be the warning signs for anybody who suspects that yes, there is something wrong and this is the time I need to basically rush off to my oncologist?
So basically you have to understand that whenever you feel a lump, you have to go to a doctor.
That's the obvious case.
There's no assumption that this is this and this is that and this hurts and this doesn't hurt. And a painless lump can be equally bad, and especially in older women. As the age increases, the chances for cancer also increase.
Right.
So in a 16-year-old, the chances of cancer are very little.
Minimal.
But if you are 40 and you are feeling a lump for the first time, then it has to be checked. So lump has to be checked. Then you can have a skin change, nipple discharge, you can have a lump under the armpit, you can feel that the whole breast is a bit heavy and the skin surface is not right, or it pulls inside. Anything can happen. So that is why you need to know what your breast is like normally. And that is the role of self-examination, which should start from the age of 20 in every woman.
Right.
So every woman should start examining, ideally from the age of 20, their breast once a month, so that they are aware of it, and if there's
Any
a
kind of
change,
changes,
then
right.
they will pick it up early.
Right. Anything abnormal which is not
Anything
normal.
abnormal, and you need to know the normal by regularly examining yourself from the age of 20.
Right,
every
madam.
month.
But coming towards you, Faisal Saab, here we must talk about the very important role then male members of the family like yourself can actually play, not only with regards to looking after cancer patients or cancer survivors, but also in making that active effort of debunking the myths, because we have seen a male population in ways more than one has advocated for some very important causes, not only in Pakistan but world over too. So how do you feel can males in Pakistan do the same here too?
When I talk about myself, I also face certain issues which I would like to highlight here. Like,
Right.
Initially, when we were taking her to the hospital, even before her treatment started, well before her treatment started, someone in my office was talking to me, and he generally said, "Okay, you can probably do a second marriage for kids." And
That's so typical.
Yeah, and at that time I didn't know what to reply to him, because her treatment wasn't even started. It was quite earlier. And then after later on, when her treatment finished and recovery had started, someone else said, "Faisal, you should do a second marriage."
Again.
So again, it was a couple of years back, and again I didn't know how to properly reply. And next time I just turned around when I saw him. But this is something we need to, make men aware that this is, this is not her fault.
Of course.
If she gets it. It's a disease.
Like any
Anybody
other
can-
disease.
Like any other disease, anyone can get it. So you should be there to support her, to drive her through this
Of
hardship.
course.
You could also face similar symptoms, similar situation sometime.
Right, Faisal Saab. On which I'll come to you, Ms. Faria. And here another thing that we should talk about is the fact that we have seen that more often than not, perhaps in the more remote areas of the country, this is something which could be possibly related to different kinds of myths which are in their own selves very irrational. And we have also seen instances of women going to actually spiritual healers or for that matter quacks so as to get themselves treated. Why do you feel, as a cancer survivor yourself, is it very important for us to ensure not only affordable but also accessible treatment for cancer patients?
Cancer treatment itself is very expensive. So we have different hospitals for that matter where they can get free treatments. When I was got this treatment, there was only 2 hospitals, but now we have a lot of options within Lahore and within other cities as well. And they are offering the free treatment as well. So those women can go there. But the diagnosis first is very important. I believe
early detection is the key.
Early detection is the most important key. And the more earlier you go and the more better treatment you will get.
Then you can definitely save yourself that way too.
Yes.
Dr. Saiba, here you would want to comment, because this is an issue that you were earlier discussing too, that do people have that access to healthcare, especially those in the rural areas?
No, because we are privileged people. We are sitting in big cities and we are relatively affluent and educated. Only 20% women actually report to a surgeon as the first person. Mostly are sort of, as you rightly said, deferred for some time at home by their mothers, mother-in-laws, husbands, that it will be fine, it happens, you know. And then once it happens, because there's an economic cost to health, people have to basically take somebody to bigger city, they have to quit work or take a day off, you know, and there's lots of stuff going around that. So there is a reluctance, and women health usually is low on agenda in if the family comes, especially in lower socioeconomic groups. So we need to develop places within the district level where these women can go, and it is easier for the families to go and attend those places and get early diagnosis. But we are not getting there.
So this is something that we need to focus on, because we need to have a very holistic approach when we talk about combating and fighting off breast cancer. But madam, here when we do talk about having a more holistic approach towards, you know, combating breast cancer in the Pakistani society, what role can policies play in this regard? Do we or do we not have the right policies here?
So the policies are very fragmented. That's the problem. You know, you have, like she said, that you have tertiary centers and then there's nothing at the district level. And then you have nothing about prevention. You have nothing about screening. So you have very, you know, isolated things which are happening. There's no national cancer registry to start with. So the first thing is to implement that and then have the policies. You know, we have like district mobile units. You can have a mammography machine in that. You can have an ultrasound. It's not difficult. Breast cancer is the most important health threat.
And one of the most common ones too. Exactly.
It is the biggest killer of young women in their, you know, productive years. And when a woman dies, the whole family is affected. You know, married or not, you know, mother dies, the children are sort of nowhere. And it's like the woman might be a career woman, you know. We are not just talking about, I don't want to basically just say that women should be empowered.
Right.
They should be able to make their decisions. And where they lack it, then the society and the government should jump in to facilitate it for them.
So, right, madam. But moving on, another angle that I would want you to touch upon is the fact that when we do talk having the right treatment methods, we understand the fact that over a period of time, Pakistan has made some headway and we have seen advancements in such treatment methods. So for the clarification of the audience, could you tell us what progress has Pakistan's healthcare system made in this regard?
So most of the research in breast cancer comes from the West. We don't have any original research here. We can identify things, etc. But whatever we have incorporated, for example, in the AI field, we can incorporate AI in screening programs, because now we know that computers can read screening mammograms better than radiologists. So you don't even need a human, resource for that, which is not being used fully, but we can use that. And then in the treatments are much better, more sophisticated. There is less amount of surgery, more targeted therapies with less side effects. And all that is being incorporated in Pakistan, but the treatment is very expensive and it's not fully funded by the government. The government tries and they give some support, and a lot of women do get better and they get some sort of medicines. Nobody is sent home without treatment, but it's not ideal.
Right.
And they are not fully funded.
Right. And then this would also definitely include those women who belong to the more remote and rural areas of the countries, because then those are the ones who perhaps might not even have that access, madam.
Even if you are going to offer completely free treatment, if two persons are going to travel 300 miles and come to a city and stay overnight, you can calculate the economic cost of it.
Right. Economic cost. This is something on which I would want you to deliberate further. When we talk about the economic cost, something which Dr. Saiba very rightly so mentioned early on during the conversation too, that a woman's health might not be on the top of the agenda for any household, more so when they might be limited household income. So in cases like these, how then can we prioritize, how then can we actually sensitize men so as to actually make women's health and her treatment in the event that she does suffer from breast cancer a priority?
You're absolutely right. In our case, in my case, we belong to an educated family. As doctors, as I've said, that we are privileged. So in my family, it was not an issue. I had support of my family, my friends, even in financial, to manage it. But obviously that's not the case with everyone. And I've seen that generally when a woman suffers this, they tend to put that things on the side or delay it somehow. So, but life is precious, whether it's man, woman. So we need to basically spread this awareness that, and also provide them if they need support. I know many support groups and individuals who are there and who provide support financially to poor people.
And this is something that we saw happening in the COVID-19 times too.
Yes.
There were so many people who become very critically serious, and there were so many people who were actually donating, paying for their treatments full-fledged too. So Pakistan, as we all know, our society is very hospitable that way. We do a lot of charity too.
Right. And it's just the thing that I think those people, they have trouble finding the right means to reach out to such people. People are there willing to help. Obviously, I know many people who are helping, but because I have access to social media, internet, everything, I can search and easily get information. Not everybody can. So these kind of people need to come out so that it's easy to access them, and it's our responsibility to spread that awareness.
Right, sir, your point is noted, on which I'll come to you, Ms. Fariha. They very rightly say when they say the only person who can beat cancer is nobody other than yourself, and you of course are the living example of that. So when it comes to advising those women who have been diagnosed of this very same disease, what advice would you give to them?
For the cancer survivors, I must say, if you are not talking about publicly about this disease, please find 4 to 5 cancer patients and support them and guide them. You are also going to face all these fears. We also face all these fears because I counsel a lot of people around me who are suffering from this disease.
And that definitely has greater impact as opposed to perhaps somebody who's not.
Yes, and they are also counseling other people just to see that if she can do, we can also do that. So it's not about you have to go on a media and talk about it. You can have your own circle of influence and support cancer patients so that we can break this taboo that this disease is not, it is a threatening disease, but you are not going to die because of this disease. You can die anyway. You
can die anyway, but the thing is that you need to focus on early detection, which is definitely the prerequisite. And in this regard, then it's also very important that more women like yourself, especially those who are cancer survivors, they come forward and talk about their plight too, and also about the fact that yes, there is life after cancer too, because sometimes the conversation is too just focused on one going through an ordeal. Yes, you have gone through an ordeal, but then you've survived that too. to. So the narrative in this regard, that needs to change too. Dr. Saiba, coming towards you, here we must talk about the need for us to focus on early detection, because early detection, as we all understand, is the key. How precisely as a society can we do that? Do we need to have greater awareness campaigns in this regard? Do we need to encourage women to opt for more regular mammograms, or for that matter regular screenings? Or do you feel that the government here has a pivotal role to play so as to generally work towards improving an average person's access to the healthcare system?
I would say, like, to start with, you can't prevent cancer. You can catch it early. You can reduce the risk. And I think I'm a very strong advocate for women general health facilities. We do not have any playgrounds for girls. We do not have any facilities for girls to, only some urban population can go to gym, right? So you need places for girls to exercise. You need better dietary regulations. You can have screening programs. You can have a national cancer registry, and then you can always start a breast cancer helpline. When somebody has a diagnosis, now what, you know? Now I'm aware, but where to go?
That's
so
right.
These are the small steps to start with, that we can on a national level do that. And you have to empower the woman. Till she is empowered, the change is not going to happen. So
right, and it is a right to be empowered to start off with, madam.
It's her body. She needs
exactly.
to make a decision. Sometimes people want them to go to the doctor, they refuse because of whatever sort of phobia and, you know, all those things. So yeah, but these are like, there are so many steps that the individual can do, the society can do, and please, and the media can show plays in a positive way.
And coming towards you, sir, and before we conclude today's show, here it's very important then to also talk about the advice that you would want to give to people from your own caregiving perspective. You are, of course, in your own right, a role model for many other people, more particularly men out there. So when it comes to caregiving responsibilities and fulfilling the same, what are the tips that you would want to give to the people out there? How can they aspire? How can they work towards looking after their beloveds, especially those who are suffering from this disease, given that they perhaps might not have the ideal resources to do the same?
Yeah, one thing I've seen here is that there are support groups for cancer patients, but I believe that there should be support groups for caregivers as well. Maybe in the hospitals, such hospitals which treat cancer, and otherwise also, because, you know, it's a very challenging job of a caregiver, emotionally, financially, and otherwise. So there should be also support groups for them, so that they could talk to them and discuss.
And they could let it out.
Yeah, and generally they should have open communication with other family members, close friends. You know, sometimes they might need help with certain things, so they should, people may be around them who are willing to help them, but obviously they need to talk to them. What happens in some cases is that they kind of they don't basically discuss their issues or whatever they're needing. So they need to have an open communication with everyone.
That's very right, sir. And you know, if you were to then conclude today's show, it's very important then to also understand the fact a mass level awareness, a mass level of education, that too which actually addresses all these socio-cultural norms, that is something which should also be prioritized by that virtue too. On which note, I would like to conclude today's show. Thank you so much, Ms. Fariha. Thank you so much, Dr. Huma. And thank you so much, Faisal Saab, for your precious time today. Well, to conclude today's show, we generally spoke about breast cancer as it does exist in the Pakistani society. In this regard, we generally spoke about the trends which we do see emerging with regards to this disease. One thing which is more unfortunate now, as perhaps was the case in the past, is the fact that more younger Pakistani women are coming forward with such cases. If we aim to do away with this disease, then it's very important for us to not only educate the common average Pakistani out there regarding this very disease. What is equally important is to, of course, ensure the fact that people not only have a timely but also affordable healthcare access to the healthcare system in this regard too. Early detection is the key to say no to breast cancer. On that note, signing off for today. Until next time, take care and Allah Hafiz.